Hi, I'm Dr. Peter Vila, and I'm a facial plastic surgeon. Thanks for checking out this video. Today we're going to talk about non-surgical rhinoplasty. You may have heard a variety of terms used to describe this procedure, whether that's a liquid rhinoplasty or a filler rhinoplasty or non-surgical rhinoplasty, but all of them are basically describing the way we achieve aesthetic changes to the nose without doing any surgery. So if we're going to talk about how the procedure is actually done, what we're using filler to sort of camouflage changes in the nose. Now, the most typical aesthetic changes that you can achieve with a non-surgical rhinoplasty are things like camouflaging a bump or making subtle changes to the tip, like giving the tip a little bit more projection, or in other words, making it a little bit more pointy and well-defined. With non-surgical rhinoplasty, you're a little bit limited in terms of what aesthetic changes you can make because you certainly can't do all the things that you can achieve with a traditional rhinoplasty. If you're a candidate for this procedure, this is a nice way to sort of trial it out and maybe save yourself a surgery if you want to make small changes to the nose. Now, what do you need to know about non-surgical rhinoplasty? First of all, you should go to somebody who is a very experienced injector. You can absolutely have bad things happen with injecting filler into the wrong places, and most of the complications that you've heard of with filler have to do with injecting filler into a blood vessel. There are lots of blood vessels in the nose, and so you need to go to someone who knows what they're doing, like a plastic surgeon or a dermatologist or somebody who knows the anatomy of the nose and knows what to do in the off chance that there is a complication. The way we achieve the changes in the nose with filler is we're using the fact that the nose looks the way that it does because of the tissue underneath. So just like a tent has tent poles underneath that are giving it that shape, and it's not the actual covering on the tent, it's the same thing with the nose. So in talking about the anatomy of the nose, you can actually feel where the nasal bone stops. It's usually in the top third. It's a little bit longer or shorter in different people, but you can feel that on yourself. At some point, it stops being hard bone and then comes down to the more squishy part, which is your cartilage. And there's several of them. There's the upper lateral cartilages and the lower lateral cartilages. Now, these lower lateral cartilages are what really gives the tip its shape. And so when we're talking about tip projection or the definition of the tip, that has to do with how your lower lateral cartilages are aligned on your nose. So in a rhinoplasty, sometimes we change those and modify those to achieve certain changes. With filler, you can also do that in terms of just giving a little bit more projection if that's what we want. And what we're doing is we're putting the filler right on top of the bone or right on top of the cartilage to give the skin a little bit of lift. So the changes you're going to see from a non-surgical rhinoplasty are basically immediate. You inject the filler, we'll form it with our hands sometimes to get it to tent up a little bit, and the way that it looks right then and there, that's how it's going to look. Now, the good news about filler is that it lasts up to about 2 years. The bad news is that it's not permanent. It's eventually going to be absorbed by the skin, and so it does not last forever. But it's a way for you to try something out if you're not quite ready for surgery, or you just want to try to make small changes with minimal downtime. Over the next week or so, what's going to happen is that it's going to absorb water, and it's really going to set in place, and no one's going to be able to feel it and know that they had filler there. And it should really give you a nice natural look that's going to look like nothing was done. So again, what are the main changes that you can make with a non-surgical rhinoplasty? How do you know if you're a good candidate? There's two problems that we can really nail with a non-surgical rhinoplasty. One of them is if there's issues with the dorsum. So a bump or maybe a low radix, meaning this part of your nose, if it's really, really sunken in, like most Asians have a very low radix, you can bring this up a little bit. You can augment it or lift it up a little bit with filler. That's one thing you can do because all you're doing is you're adding volume. So you can add volume to the radix, and if you're trying to camouflage a bump, you can add volume above and below it, and it makes it look nice and smooth. The other thing that you can do with filler is really get the tip projection better. And so in somebody with a really flat nose or boxy nose, you can add a little bit of filler to make it more pointy and more defined. And so by taking the filler and putting it right on top of the cartilage, you're making a nice aesthetic tip. So where is this procedure done? Unlike a traditional rhinoplasty that's done in the operating room under general anesthesia, a non-surgical rhinoplasty can really just be done in the office. Typically, I'll have patients numb with numbing cream on the skin, and then we do the injections right there in the office. The whole procedure really takes about 30 minutes from start to finish, and really the pain is just with the injection itself, so it's not a terribly painful procedure. If this is something that sounds of interest to you, please talk to your local provider about it, and thanks very much for checking out this video. My name is Dr. Peter Vila.